Hello and welcome to part 3 of Avisena's 3-part webinar series, ICD-10, Where Are We Now and Where Are We Headed? Just as a reminder, we have the entire 3-part webinar series schedule posted online on YouTube. So we've provided the keywords here, Avisena ICD-10 webinar, so that you can find all of these recordings. And of course today we're going to finish it up, further defining the implementation process and some of the courses and services available from Avisena to help our practices. To provide a high-level overview of the material that we've seen so far in parts 1 and 2, the first thing to note is that compliance deadline of October 1st, 2013, which is the current deadline for all of these changes to actually take place. Next, we're looking at a code set that's expanding from approximately 14,000 codes with ICD-9 all the way up to over 69,000 codes with ICD-10. Within that, we're seeing the code structure itself expand from about 3 to 5 characters up to 3 to 7 characters, and with that comes a greater need for specificity to appropriately code in ICD-10. Because of all this, training and education is going to be required at all levels to expect a smooth transition. And of course, you can expect changes at all levels, specifically looking at process flows from the eyes of the office managers, billers and coders, and physicians. So this is a very impactful change that we're seeing, and all levels of an organization will be responsible for some level of training to be ready for a smooth transition. So the topics for today's webinar will include recapping some of the information that we've looked at with respect to the code set. We'll look at the general equivalency mappings, or GEMs, some assessment and SWOT analysis tools, further looking at implementation and planning, and then discussing some of the courses and resources that Avisena will have available for our practices. At this time, I'd like to introduce Wendy Frierson. She is Avisena's Director of Compliance and Education. She is an AHIMA certified ICD-10 instructor. Welcome, Wendy.
Good afternoon, and thank you for attending our final session on ICD-10. Today we're going to talk about the changes and the implications of ICD-10. This slide indicates an example of the coding structure for ICD-10 and the need for the specificity in the documentation. Here we have an example of a fracture of an unspecified part of the right clavicle, initial encounter for a closed fracture. In the coding structure, the first 3 characters represents the category. The second 3 characters represents the anatomical site, and the 7th character represents the extension. Remember, not all codes will have an extension under the ICD-10 coding structure. In this slide, we have an example of the coding structure under ICD-10. Here we have an example of a patient with heart failure due to hypertension. However, because of the specificity, there are a great deal of options for the heart failure. This is why it's very important that when the physicians are documenting, they're documenting the exact specificity. In order to code and select the appropriate type of heart failure that's due to hypertension, the physicians will need to document accordingly. We will discuss the definitions of a crosswalk and mappings. We've discussed general equivalent mappings in both of our sessions. Crosswalk, it's really a direct one-to-one linkage from one code to another. And mapping, we have a linkage of a variety of codes. It may be complex, and it can be usually a conversion. So, in our next slide, it will provide an example of how the crosswalks and the mapping integrate under ICD-9 into ICD-10. In this slide, we have an example of 5 different types of general equivalent mapping types. The first one is exact. This is when you have one code and it's translates from ICD-9 to ICD-10. It's a 1-to-1. And our next example, we may have one code in ICD-10 that may have multiple codes under I-9 with the same meaning. We have combination codes. For example, we may have gastritis under ICD-9, which are 3 codes in order to code that appropriately. However, we may have one code associated under ICD-10. Then we have the alternates, where we may have multiple codes under I-9 that lines up under one code under ICD-10. And then we have our more complex, where we may be looking at diabetes, hypertension, different types of heart failure, and under I-10, you may have different mapping combinations. So again, mapping is used as a tool. It is not 100% accurate, so we do not want you to use this as your coding tool. The appropriate resource should be the ICD-10 coding book. The clock is ticking, and as you can see in this slide, it can be very costly. Avisena will not be totally affected by all of the costs associated with ICD-10. Avisena will take care of the software and the technical component for all of its clients, making sure that our systems have the updated ICD-10 as well as the ICD-9. We will continue managing the denials. However, these numbers are based on case studies performed by different organizations. And again, these are just estimates and they're not actual cost. The cost of ICD-10 can range anywhere from $84,000 to about $1 million, dependent on the size of the practice. There are over 850,000 providers in the U.S. This is a big question. What does this mean to you? Avisena clients, please understand that you will not have to undertake this massive change alone. We are committed to partnership. The ICD-10 Readiness Assessment. This slide provides an example of a readiness assessment tool. All items in this worksheet will not pertain to everyone and every practice. This is just an example. There are less complex assessment tools available. This is one of the many tools being used by Avisena's ICD-10 implementation team. The assessment process worksheet enables organizations to identify which systems and processes will be affected by the ICD-10 transition. Management will gain information on where to apply resources in preparation for the change. Users of this tool are encouraged to modify the worksheet to meet the specific organizational needs. The information included here is merely a sample of the types of processes and systems that should be examined during your transition. Each strategic component will have requirements related to each column and the importance of its rank. It is critical to understand the priorities in order to plan and prepare for the transitioning to ICD-10. Now, this slide provides an example of a SWOT analysis. And a SWOT analysis will need to be performed by every area within your organization. The purpose of the SWOT analysis is to identify your strengths, your weaknesses, your opportunities, and your threat analysis. This is going to help you better define your process for ICD-10. So this is going to be vital, and will be one of the first steps that you'll have to take in order to develop and define your process for ICD-10. In this slide, we have an example of an ICD-10 project committee. This will be required in order to have a successful ICD-10 implementation. And each of these roles are very important. However, for this webinar session, we tailored the responsibilities based on the typical practice. However, the administration is more of a cross-functional role. We have the billing and the coding. We have your clerical and the referral coordinators. We have your clinicians, which will be your physicians, your nurse practitioners, and your PA. And then we have the medical assistants and your technicians, and we'll also have someone from finance. However, the office manager will be responsible for developing this project committee. However, if it's not within your scope, we would recommend that you hire a consultant, because this role is very important, and how the roles are executed will determine the success of your ICD-10 implementation. This slide consists of timelines. Timelines will really help you define and stay on target for the ICD-10 implementation process. Each area will be assigned a specific task and a timeline to complete the task. And this is something that will have to be monitored very, very closely. And for example, we have the referral coordinator. On January 30th, 2012, everyone within the organization needs to have some type of formal ICD-10 training or an in-service. And then on March 1st, the referral coordinator will need to confirm information with the carriers and so on. This is going to be how you track and monitor your success, and how you monitor how each individual is fulfilling their roles as it relates to ICD-10. So again, establishing your timelines will be very important, and you want to make sure your timelines are realistic timelines that can be obtained within your organization. Here's an example of an ICD-10 task log. Once you've assigned your responsibilities to your individuals along with the timelines, you would like to track the process and the progress. So here is just an example of the date that the assignment was assigned, the person or the group, the task, the due dates, and the comment, and the completed date. This is very important. This will be your communication log throughout the duration of the ICD-10 implementation. So it's very important that you track each individual's task along with the timelines and the completion date. If for some reason you're unable to complete a task on the assigned date, then it needs to be communicated. And this type of log or this type of tracking mechanism will assist in closing the gap to ensure that everyone's meeting their expectation as it pertains to ICD-10. This portion of the webinar, we're going to discuss implementation and planning, and we're going to provide tools and processes that will assist you with your implementation and planning. And action. You need to have an action plan. Once you develop your action plan, you need to act now. You need to have strategic planning and budget. You need to develop your task force team. You need to prepare to train the trainer, partner with your vendor to create tools. As for Avisena clients, we will make tools accessible to all of our clients to assist with the preparation for ICD-10. Call to action, understand the impact, understand how ICD-10 will impact every business area within your organization and all the components that are required. So it's very important that you develop an action plan and make sure that you follow through. Again, budget is going to be critical in the success of your ICD-10 implementation process. Now we're going to discuss 2012 readiness. Real-time training will be required for everyone within the organization. You want to recheck and revise all of your systems and processes. Avisena's clients will not be burdened with the system changes. Avisena will take care of all the system changes for their clients. Develop and implement a budget. Avisena's client will not be impacted or will have less of an impact as it pertains to the budget. Activate full implementation plan. Avisena is providing tools to assist with this process. Again, the time is ticking. 2012 is just the jump start. So again, be prepared, look at all your functions, and make sure you're ready for 2012 readiness assessment. Now we'll discuss the impact that ICD-10 will have on providers. You're going to have coverage and payment issues. New coding systems will mean new coverage policies, new medical review edits, new reimbursement schedules. Changes will be made to accommodate the increased specificity that's required with ICD-10. You may want to discuss changes with your patients, your contracts with your providers. Coding will be more specific and include severity, renegotiation of your contracts based on the new coding guidelines. It will be difficult to measure what changes will take place in the overall reimbursement. Avisena has committed to assisting all of its clients to mitigate some of the impact. It's very important, providers. You want to look at the entire picture as it relates to ICD-10 and the impact that it may have on your individual practice. As a part of the ICD-10 implementation, you must have an approach, and the approach must be detailed. I'm not going to cover everything in this slide. However, you want to drive it, you want to make sure you discover it, you want to diagnose it, you want to define it, and then you want to execute it. A detailed approach will really assist with a successful implementation ICD-10 process. We will discuss a few implementation strategies. Let's talk about the review of the impact areas. You want to make sure that your benefit coverage, your policies, your provider relations, claims processing, fraud and abuse, budget and estimation, quality measurements, your basic strategy session tips. Prior to the session, determine the goals of the session. Include several people from different areas for different viewpoints. Include those who will manage and implement the process. You want to include your billers, your coders, and some clinicians. Review your contracts to make sure that if changes are required, then you're going back to the payers and renegotiating those. And other implementation activities. Ensure that your FIs, your carriers, or your MACs, which are your Medicares, your Medicaids, have updated their claims processing software. Track your claim rejections based on ICD-10 coding. Continue to educate your payers. Yes, providers, you will have to educate your payers. Continue to educate your coders. You want to track your coders' quality. You want to monitor your documentation issues. So you want to make sure that you're covering all bases as it relates to ICD-10. We'll discuss revenue and expenses as it relates to ICD-10. You want to know how much is your ICD-9 based. You want to maintain your revenue for post-ICD-10. Create new customers, create an international focus. You want to look at your expenses, your payers, your reimbursement and medical policies must be updated. Providers' contracting and communication is very important. You want to communicate to your patients that we're moving to a new coding system, that the country is moving to a new coding system. So there will be some changes. You want to make sure that all of your providers understand the impact of ICD-10. If you're using a coding and billing service, make sure that they totally understand and they're educated on ICD-10. Again, you want to educate your patients. As far as hard copy super bills, today the average provider uses about 1 to 2 pages for a super bill. Under ICD-10, we're looking at 9 to 11 pages. Under the ICD-10 coding structure, paper super bills will become obsolete. Providers, you want to look at your top 50 ICD-9 codes that you're using, and then you want to formulate a super bill that will be feasible for you to use under the ICD-10 coding structure. Again, look at your 50 most used ICD-9 codes today and then translate those into ICD-10, and that will be a starting point for you. As we all know, training is vital for ICD-10. Creating a training plan. A plan should be specific and identifying training courses, stating who should be trained, when, and when their training will take place. The types of training that will be required will vary dependent on the responsibilities within the practice. Again, who should be trained? Everyone in the organization should have an introduction to ICD-10. Your top executive managers would really have a high-level training of ICD-10. When do you start to train? Physicians, you want to start to train your physicians as soon as possible on clinical documentation improvement. If the providers are documenting specificity, then the coders will be able to assign the appropriate ICD-10 codes. Again, there's different types of training for the different responsibilities and the levels within an organization. So a provider would not have the same type of training as a coder, and the receptionist will not have the same type of training as a provider. So when you look at your SWOT analysis and you're planning your timelines, these are things that you want to take into consideration. Creating a training plan, who should be trained, when to train the staff, and the different types of ICD-10 training that will be required for each individual within your organization. Avisena will be offering ICD-10 training courses March of 2012. And we will also be offering the CPC, which is the Certified Procedure Coder, the CBCS, which is the Certified Coding and Billing Specialist, and other courses beginning January 2012. In this slide, we have 4 bullets on coding and documentation, compliance and quality. In the clinical area, this will be the largest area that's impacted by ICD-10. Since ICD-10 CM is more robust and has up to 7 digits of specificity, documentation will need to be more specific, more detailed prior to the go-live date. How do you solve the problem? By educating your physicians, showing he or she the comparison between both coding systems. Encourage your practitioners to begin documenting more specificity for ICD-10. This is the most important mechanism in working with physicians, documentation and communication. If the physician sees what mistakes he or she made by reviewing the medical records along with an audit, this can help clarify some of the muddy waters. How to begin? Take an in-depth look at your current documentation. Review the documentation to see if it lacks specificity. If it lacks specificity, go back to the doctor and query the physician for more specific information. How to approach? Look at your ICD-9 today, compare it to ICD-10, look at the approach that you're using today, and see if you can still take that same approach and implement that into ICD-10. If not, then you need to look at other ways of documenting and making sure that the provider's documentation includes specificity and it's compliant. It is recommended that providers perform an ICD-10 CM readiness assessment, and the CM is for the clinical modification for the diagnoses. Many practitioners have either had their staff conduct an audit or they've hired a consultant to conduct audits. It is very important that the providers understand the element of compliance. You want to take a different approach. What actually needs to be done is to review the patient's chart note to make sure that the physicians or non-physicians and practitioners are documenting a complete diagnosis. Now is a great time to start this type of assessment. If we can get our providers to start documenting specificity under ICD-9, it will be an easy transition for ICD-10. Here we have a case example on coding ICD-9 and coding ICD-10. We have a 3-year-old who was seen in the ER today after having put a raisin in her left nostril while visiting her grandmother. The raisin was removed from the nostril. Under the ICD-9 code, the code would be 932. Foreign body removal from the nostril. In ICD-10, there would be 2 categories. So we're going to move to the next slide so that you can see the difference and the specificity that's required. Now, the continuation of the case. Under I-9, we have 932, which is foreign body removal nostril. However, when we translate that into ICD-10, we have 2 options. And why? Because of the specificity. The first code is T17.0XX, and it is foreign body in the nasal sinus cavity under the initial encounter. Under the second code, we have 217.1XXA. This is foreign body in the nostril, and it is under the initial encounter. So it is very important that the providers document specificity, because under the foreign body removal, we have the nasal cavity as well as the nostril. So it's very important that specificity is documented under the ICD-10 coding structure. In this slide, we're going to discuss billing and coding issues to consider. We will have a new code set as of October 2013, which consists of 69,000 codes. We'll be working with both code sets for about 18 months. That's cleaning up your old claims and submitting your new claims. Also, workers' comp carriers are not required to convert to ICD-10, as they are not HIPAA-covered entities. This may cause a problem and will cause additional productivity issues. We will see an increased number of claims, follow-up, and resubmissions. All policies and procedures will require some type of update. Payer contracts may change. You should contact your payer reps. It will be very important to track and trend your denials as it pertains to ICD-10. These are just some of the issues to consider for billing and coding, and this will have an impact on your cash collections. This slide provides an example of the reimbursement impact. A general surgeon submits about 160 claims per week with a total dollar amount of $145,000. During the implementation period, you may lose 10 to 25% of productivity. How does this impact your practice financially? This is something you want to consider during your assessment. We've discussed your assessment, SWOT analysis. We've discussed how important making sure that you have a budget and you have a plan, because at the end of the day, ICD-10 will impact your practice, whether financially, resources, lost productivity. So Avisena wanted to provide you with an overview of ICD-10 and all the components of how it may or may not affect your practice. So we're going to move on now to some different types of forms that you may be able to incorporate during your ICD-10 implementation process. Now we'll discuss the different types of forms that may assist you in your ICD-10 implementation process. The first form is a communication tool, and it's vital that you have an open line of communication. So this form provides you with the name, the format, the responsible party, the frequency, and the timing. However, you can modify this form, but you need to have some type of form of communication. This form talks about IT requirements, and you would want to look at every department within your organization that uses software or vendor. So you may have to change or replace. For Avisena clients, as far as the platform, we will take care of all of the IT components as it relates to Avisena platform. But this is a great tool, and you would want to look at, again, every department where there's an IT functionality, whether it's software or vendor, and if that component needs to be changed or replaced. So this is a great form, and I think it will be very useful when you're doing your assessments. Now, the clinical impact, this is very important when you're auditing your medical records. You want to document the documentation issues, the responsible party, the resolution, and the timing. And this is going to be very critical for ICD-10. So this is a form that you would want to use. You may want to add more to it. However, this will help you define your deficiency and your specificity and put in a plan of action to resolve the issues, whether it's training, meeting with your physicians, and the timing that's required in order to resolve these issues. The process ICD-9 report. This report will be used to identify all of your current reports that you're using today under ICD-9. And the purpose of the reports, the frequency, and if the reports needs to be replaced or modified. And this will be by department. So this will be based on your current reports that you're using today under the ICD-9 coding system. The process impact for your new ICD-10 report, based on the outcome of the ICD-9 report, if the reports are going to be deleted or updated, all the reports that are required under ICD-10 is where you're going to report this is where you're going to report those reports. You may have to create, modify, update your report as it pertains to ICD-10. So this will be a report so that you can track the reports that are required under the ICD-10 coding structure. This report is an ICD-10 follow-up of different activities. So if you have miscellaneous activities that you want to follow up on, you're going to document the activities and the due date. This is something that's a universal form, and if there are items that need to be followed up on, you may want to use a form in this format. Again, all of these forms can be modified to your practice needs. There's nothing set in stone. However, we're just providing you with some examples of the types of tools that's required under the ICD-10 coding structure in order to have a successful implementation process. This slide provides an example of an ICD-10 implementation project plan template. This slide provides you with a lot of information. The information may vary by practice. Again, this is just a guide to provide you with some items to consider during your planning period. What's important is that you establish a tool and key project members in order to assist in the implementation for ICD-10. Avisena Institute will be offering a variety of courses in 2012. This slide indicates the courses that are offered at Avisena Institute, the timelines. If you would like additional information on the courses, please contact your practice consultant. I would like to close by stating, do not underestimate ICD-10's impact. Regardless of your solution approach, you'll have to deal with ICD-10. It requires people, processes, and technology. If you feel that it's not within your scope, hire a consultant, partner with your software vendor. Avisena will assist its clients within our scope as it relates to ICD-10 implementation and training. I thank you, and I will turn this over to Jeremy.
Great. Well, we want to thank Wendy for her time today. And we're going to wrap it up with our resources page. Here we have some URL links to important information and resources available from our discussions on ICD-10, including the Avisena Institute. And we certainly appreciate you attending our 3-part webinar series, and we look forward to bringing you more relevant content as it pertains to our industry. Stay tuned. Thank you.